Hello, this is Safa Biradar, and today I'll be talking to you about menstruation, also known as periods. I'll be covering ovulation's relationship to menstruation, symptoms of menstruation, age in relation to it, the importance behind tracking one's period, using period products and not using them, and finally, societal views around menstruation. Ovulation sets the stage for menstruation, occurring about 14 days before it. Ovulation is when a mature egg is released from an ovary, mature meaning that the egg is ready to be fertilized. Hormones such as estrogen and progesterone make the uterine lining spongy with tissue and blood for the egg to land on a spongy place. If no fertilization occurs, the uterus sheds its lining, starting menstruation. This is because the egg does not need the lining, as it was not fertilized. Menstruation occurs about once a month for about 5 to 7 days. It tends to occur around the same time every month. The main symptom of a menstrual cycle is vaginal bleeding, which is caused by the shedding of the uterine lining. Menstrual blood mostly consists of blood and tissue from the uterus. Other symptoms one may experience include abdominal pain, sore breasts, mood swings, and diarrhea. If one is experiencing severe pain during the period, however, they should consult a medical professional in case there is a deeper medical issue causing it. Someone with a uterus tends to get their first period around 11 to 14 years old, at the beginning of puberty. While they can get it before 11 years or after 14, they should consult a medical professional once they hit age 16 and have not yet gotten their period, as this can be a sign for a health issue. For the first couple of years of having a period, the cycles tend to be longer than 38 days and irregular. During one's 20s and 30s, their cycles tend to be around 24 to 38 days and be more regular. Menopause, which is when one stops menstruating, tends to occur around 45 to 55 years old. During the transition to menopause, one's cycles tend to be more irregular once again. However, it is more likely to develop uterine cancer with age, which can also cause irregular menstrual cycles. As such, one should see a medical professional if they begin experiencing irregular bleeding around menopause just to be safe. Tracking one's period can be helpful by helping them better estimate when it will next come and by helping them be able to better recognize irregular bleeding. As mentioned before, irregular bleeding can be a sign of a health issue. Some reasons for irregular bleeding, aside from one going through the first or last years of getting their period, include pregnancy, breastfeeding, eating disorders, polycystic ovary syndrome, and pelvic inflammatory disease. Some period products to help with the bleeding include tampons, pads, period underwear, and menstrual cups. However, caution should be used when using a product that is inserted into the vagina, as one could develop toxic shock syndrome, also known as TSS, if the product is left in for too long, or if it is a tampon that is more absorbent than needed. Free bleeding, on the other hand, is the practice of doing nothing to stop menstrual bleeding. This is done in both private and public, though it depends on the reason for doing so. When it comes to free bleeding as a movement, free bleeding has been used to protest against and raise awareness on several issues. For example, in Britain, the government refused to repeal a tax on period products, classifying them as luxury items, leading to Charlie Edge and Ruth Howarth free bleeding outside of Parliament to show how period products were not a luxury. Free bleeding is controversial, however, as there are some diseases, such as HIV, that can be spread through blood. It is also seen as controversial due to the negative societal views around menstruation. Menstruation is considered taboo by many people for multiple reasons, such as culture, religion, and incorrect information regarding menstruation. For example, some believe that if a woman is angry or moody, it is likely due to their period influencing their emotions, which is not always the case. Due to the taboo around menstruation, many people do not openly discuss it. However, discussing menstruation more could help dismantle misbeliefs surrounding it. Additionally, more in depth menstrual education being taught to all people would also help dismantle disbeliefs surrounding it, therefore, getting rid of the taboo around menstruation. As such, let's talk about it. Not talking about menstruation is one of the reasons it has become kind of considered this uncomfortable taboo topic. And also, there's more false information than you'd think there'd be about it out there, just negatively impacting the lives of people who do go through menstruation, which is completely a normal biological process. So let's destigmatize it and let's talk about it. Thank you for watching and have a great day.